Hello, I'm Dr. Gopinath Bandari, consultant hand, wrist and microsurgeon. Today we are going to talk about wrist drop, its causes and treatment. Wrist drop is complete drop of the wrist, fingers and the thumb. This is caused by a radial nerve palsy, which can be high radial nerve palsy or a low radial nerve palsy. So when radial nerve, which supplies the wrist extensors, finger extensors and the thumb extensors, when that radial nerve is damaged, either because of a fracture or because of a compression or because of any surgery, when such nerve is damaged, this wrist drop, including thumb drop and finger drop, occurs. When it happens above the elbow, it is called as high radial nerve palsy, and when the same injury occurs below the elbow, it is called as low radial nerve palsy, or also called as pin palsy. In pin palsy or low radial nerve palsy, we see only finger drop and thumb drop, and classically the wrist extensors are spared. So depending on the cause, whether it is high radial nerve palsy or low radial nerve palsy, we differentiate based on the symptoms and the presentation, how the patient is presenting. If there is no recovery, spontaneous recovery of the nerve, if it doesn't happen, we have to do a tendon transfer for wrist drop, so that the wrist, finger and the thumb extension is preserved. And if there is an evident nerve injury, if the patient is able to present to us very early after the injury, in those circumstances we can explore the nerve and do the nerve repair primarily, so that the spontaneous nerve re-nervation happens and they will get spontaneous recovery. In cases of delayed presentation, tendon transfer is a viable option. For pin palsy, which is a low presentation of a radial nerve palsy, in such cases we can again do a tendon transfer and restore the thumb and the finger extension. Sometimes, rarely, we do see pin palsy or a radial nerve palsy without any injury, and mostly it is called Saturday night palsy, which is usually caused by compression of the radial nerve, either by sleeping on the arm on one side for prolonged time, which usually happens post some episode of binge alcohol drinking or a deep sleep, which usually happens on a Saturday night binge alcohol drinking, and that causes the patient does not know about the compression over the radial nerve and sleeps on his arm, and thus the radial nerve gets affected and causes a wrist, finger and a thumb drop. Such cases can be well dealt without any surgery, and medicines can help a spontaneous recovery within 6 weeks. So this is about radial nerve palsy and wrist drop. Thank you so much.